Dr. Jane Ratcliffe. I'm a consultant in intensive care here, but I also chair Alder Arts. I've been involved in this project for probably about 4 years. In essence, it's looking at what dance can do in a healthcare environment. The benefits of dance are much greater than we ever imagined in the first place. Obviously, the children were very keen to be involved. They liked the props, they liked working with the dancers. In fact, they were queuing up to work with the dancers because they were so good. But when we applied it to looking at how the children and young people reacted when, for example, they'd had an operation and were recovering, were in pain, the dance seemed to relieve tension, and they were a much less need for pain relief, and in fact that means that they can get home earlier, and that's such a positive thing.
Kath and I work with movement and touch, relaxation, lots of different sensory objects to encourage movement across different wards in the hospital, both surgical and non-surgical, to engage children in creative movement and play. For some children it's kind of passing the time and reducing anxiety before surgery. For other children it's about getting them moving after surgery, which can help reduce their pain. For children who've had brain injury, for example, we work a lot with developmental movement patterns and support their recovery and rehabilitation.
With children who have complex special needs, who don't move very well, sometimes we were able to engage them in dance, and because they felt so relaxed and they were enjoying it, they seemed to achieve more than sometimes even with the neurophysiotherapist.
The work is quite varied, and I think what's quite special about the work is that we can work with children, babies, older people, so it's really centred around them and their kind of interest in creativity and play. So we really start with that and follow them, which is what I think makes this project quite different.